Hi, this week we're looking at functional assessment techniques in clinical assessment techniques. Let's start with looking at a couple of videos. What I'd like you to do is scribble down on a few pieces of paper the kind of things that you would want to ask this client or assessment skills that you'd like to do with them. So the first client, we'll look at one client, and he is an amputee, both upper and lower limb. And again, an interesting case to start with. So we'll start with some gait observation. What are the kind of things that you're looking for? And what are the observations? From the last few weeks, we could use an Edinburgh Gait tool to be able to report his gait function, or otherwise we could use descriptive observations. If we were going to assess him based on our gait observations, what tests might we want to look at? Would we want to look at range of motion, perhaps? Which joints? Could we assess leg length discrepancy? That might be useful. So there's a range of tests here that we know might be useful. However, in the big picture, what we're looking at is the person as a whole. So overall, how is this gentleman functioning in his day-to-day activities? Being an upper and lower limb amputee raises the question of how does he manage during the day? In this next video, we can see him donning his prosthesis, his upper limb prosthesis. So again, what are the observations that we can make? There's some clearance tests we can imply. He's got good shoulder range, good dexterity. And if we look at the lower limb, we have, again, functional assessment of his ADLs. He can actually don the orthosis or the prosthesis effectively. However, it's not the end of the picture, is it? This tells us that he can put his device on. It tells us we've seen that he can walk. But there's also a range of other things which we need to be able to think about. And this is where functional outcome measures is a really important idea. And functional outcome measures provide a measure of function which can be used as a comparative tool to track function over time. So again, this idea of being able to take a point in time, report on someone's functional level or a status of that, and then compare it to change over time. We've looked at some of these criteria already. We've looked at things like balance and gait, and touched on things like pain, which isn't on this list as well. Dexterity and performance are all kind of characteristics we looked at. However, in the real world, as we all know, things like quality of life and social participation are very important, but maybe less clear as to how we measure them. However, within the International Classification of Functioning, or the ICF, This is a really important part of a highly recognised aspect of a person's health. This model, which you may be familiar with, provides a framework of how we can understand people's perspective of health. So largely in our profession, we look at body function and structure and activity, and things like joint range of motion, muscle strength fit into these criteria, and things like gait also fit into these criteria as well. However, participation and things like quality of life are recognised as being inherently important to a person's well-being, and we can actually both influence those through our interventions, but also measure them through outcome measures. So when we plan outcomes, and this is a really important slide to think about how we do that for both physical and more social participation ideas, we need to think carefully about the process we do that. So first of all, we should assess the situation of the client. And one of the key things we need to do there is identify their goals and their concerns. This is the primary aspect of patient-centered care. It's no good doing something just because we can. We need to help our patients achieve what they would like to. We then can design an intervention and or a comparison based on the goals that they've identified. And this is where it's really important to select an appropriate tool. This picture here, I think, is an interesting one, slightly comical. There's an old man in a wheelchair with a number of walking aids, and the clinician has given him a survey or a questionnaire, and you may not be able to see it, but the first question is, are you able to run for a bus? And of course, the clinician has this dawning realization that it may not be a valid tool for this client. So choosing appropriate tools for the clients and their goals is very important. And then we need to determine the outcome and whether it's what that actually means. And this is where, as we've talked about in this subject before, comparing against normative data can be particularly useful. So let's go through a bit of an example and how we could look at this. So if we use this model, we can assess the situation. So if we have an elderly amputee, they've also had a stroke and they're living at home. One thing which, from a clinical perspective, we might say is that they have a high falls risk. And this is something which is often identified by the client as well. They might say, when asked, what concerns do you have living at home? They say, I'm really concerned of having a fall in the bathroom. So straight away, we have this alignment between a clinical concern, but also primarily patient concern. So if this is the goal, to reduce falls and to manage those, an intervention that we might use is a falls management program. And that might also involve prosthetic review. So we might adjust the prosthesis to be more stable. We might change components to make it more stable. And we might also include multidisciplinary interventions. That might be some physio training or an occupational therapist to put handrails in the bathroom and a toilet seat. Something like that might actually be really effective. And then the outcome that we might use might be something like a falls diary, which is a self-reported method of reporting how many falls someone has. Or we might use a more validated, repeatable test, something like the Berg balance test, which can evaluate those interventions and how they've affected the person. The Berg balance test we've looked at before, so I won't talk about this for long. We know it measures balance across a range of functional activities. And again, these questions might be really valid and really useful for a person in their home. And we know that, again, we can interpret these scores, and that can give us a really useful guide to both track change over time, but also to identify the level of assistance required, for example, or the level of independence. So this is an example of a good physical assessment tool. However, as we've hinted at before, not everything is physical. And we know that, with this kind of model of understanding, that we're made up of physical components, but we also have mental and social aspects as well. And again, this is where the ICF, we come back to this idea of identifying participation as a really important tool. So one example I'll talk through now is a tool which is specifically designed to measure this domain within the ICF of participation, and that includes quality of life. And it's called the Stroke-Specific Quality of Life Scale. And not surprisingly, the population that we would use this for is a population of people who have experienced stroke. And so an example of what this looks like, this is a 49 point questionnaire, which is done with the client. And the scores range between 49 through to 245, with the highest score being the most independent. And the scoring system is similar to what we've seen in other systems before, on a 1 to 5 scale, 1 being total help, couldn't do it at all, or strongly agree, through to no help needed, no trouble at all, strongly disagree. So we can see that the highest functioning people will score 5, and if they score 5 for all 49 questions, they'll end up with 245, which is the maximum. So this example, if we look a little bit deeper, brings out questions and aspects to measure which we don't normally see in a lot of our physical testing. So the first block that I've put up is this questionnaire on mood. And so there's 5 questions here on how a person feels about, for example, their future. So I was discouraged about my future, or 3, I felt withdrawn from other people. Now, all of us know that they're really important aspects of life, aren't they? So if we're scoring 1 in those areas, it means there's really significant, concern about how someone is engaging and participating in life. And in a similar way, another section looks at social roles. So this is the idea that we have about how people engage in life. So we have things like, this really touches on social participation. I didn't go out as often as I would like. We want people to be active. I don't see my friends as often as I would like. I had sex less often than I would like, and my physical condition interfered with my social life. So these are all really important aspects, and they touch on socialization, general well-being, sexuality, and self-perception to a certain extent as well. And finally, the other thing which we know is really important is the role of the person in the family. And these, again, are really important questions that we can, report on and engage in. So I didn't join in activities just for fun with my family. Or if someone said, I felt I was a burden to my family, this is a really important aspect of clinical practice. We don't want people to feel like they're burdening their family and ending up with terrible consequences related to that. So this stroke-specific quality of life scale is just one example of a functional scale, which addresses more than just specific physical aspects. And so I'd like to encourage you to look more broadly and to think more broadly about the kind of tests that we're looking at and how addressing the whole person can be a really effective and important part of our clinical practice and our clinical assessment. So in summary, we know that outcome measures can evaluate function over time, and that these outcome measures can include both physical and non-physical components. And the non-physical components are things like quality of life and participation in life. And regardless of whether we're using physical or non-physical assessment, we need to really carefully select the tools we use based on the goals and the target area which we're trying to evaluate. We'll finish this lecture here.